Thank you for the opportunity. I am gonna share the podium with Dr. Gassan Abou-Alfa as well, but I will start with try to summarize some of the concepts we heard today and hand over to Gassan.
Dr. Zein, could you just introduce yourself by title for those people
Sure.
who don't know?
My name is Nizar Zein. I'm a physician. I'm the director of the Liver and Liver Transplant Center here at the Cleveland Clinic, and also I am chairman of Global Patient Services, so I'm heavily involved with the international activities of the Cleveland Clinic. So as for the morning, it started with Princess I'm blanking on her name, I'm sorry at the moment, a recipient of the... Yes, thank you. She received the C3 Global Women Empowerment Award. Congratulations, very well done. She had very insightful opening remarks on how COVID accelerated innovation in healthcare and at the same time had some detrimental effect on certain aspects of providing medical care, such as supply chain and other pieces of access to healthcare. The most important message I found is a reminder, and I'm using the princess words, where you live should not determine whether you live or die. So provide equitable access to healthcare is critical moving forward. We moved from that initial opening remarks into our first session with doctors Hashmi, Robilotti, and Alessi, talking about COVID-19 healthcare impact on the use of data in healthcare. We heard how COVID-19 forced the need to actually extract data and have interpretation of this data a lot faster than what we used to. We don't have as much time to come up with processes that take a long time. How we use this data that we acquire fairly fast in creating new infection control policies and in managing PPEs, the personal protective equipment in a hospital setting, for example, to protect the staff of healthcare. We also heard how the response to COVID-19 globally has been quite heterogeneous, where that response in some countries led to a lot faster control of the spread of the infection than other places, and what lessons we can learn from that. That session really ended with fascinating discussion over the role of trust within healthcare system to drive good outcome of healthcare, something that even had become maybe harder to achieve in the digital format that was forced on us, such as telemedicine by the COVID-19 pandemic, and how social determinants of health are now identified in a much greater way as to driving the final outcome of healthcare. We moved into the following sessions with Dr. Abou-Alfa, Jensen, Schwartz, and Al-Amiri. It was really a high-quality discussion of the Internet of Things and how this new digitized form of communication within healthcare have a great potential in changing outcomes of healthcare. The discussion focused to a large part on not only how technology may potentially drive outcome, but also on the important piece of data privacy and security, because without these pieces of privacy and security of data, the data acquired by these technologies may not be as practically used as it should. The following session, delivery of world-class care at the time of COVID, was led by Doctors Weiner, Gross, Lehman, and Borstelman. Collectively, they really gave us a nice presentation of how best-in-class medical center had to organize both internally and externally to manage the staff of medical care as well as the patients associated with these medical centers, how different groups use telemedicine, for example, in different ways to reach their patients, and how innovation had helped the innovation in that aspect helped to reconnect to patients both emotionally and physically. The final session we just heard was a fascinating discussion between Mr. Glenn Keys and Dr. Maliha Hashemi. It is so fascinating. We heard about how we take technology into real practice. We heard about how this has been done at NEOM, a project in Saudi Arabia. I am so fascinated by the discussion that I already added NEOM on my bucket list of places to visit as soon as COVID pandemic is over. It's really very different, and I use the words of Dr. Hashemi of they are trying to humanize technology. Actually, it is fascinating statement to humanize technology, because technology alone doesn't do much if it doesn't connect to the day-to-day life and become personalized in our life. We also heard about how Aspen Medical stepped up their platforms of technology to serve in a much better way through telemedicine and through to provide services to patients, whether it's medical care or beyond medical care. I would like in the last minute or two to switch a little bit topic about something didn't come up this morning, but I think it will be very hard to talk about Middle East and what the future look like in Middle East without a few words about it. And that is the topic that had occupied a significant share of the daily press in the last couple of weeks, which is the UAE Israeli Abraham Accord to normalize diplomatic relations, and what could that have impact on the Middle East, particularly we are here interested in healthcare, science, and technology. By doing so, the UAE had become the third Arab country to normalize a relationship with Israel, following what Egypt done in 1979 and Jordan in 1994. If looking at the press, there are a number of factors that had been cited and referenced in the press as to what drove this accord, including the US election, including the Iran factor and others. But it's in most simplistic form. This accord is perhaps a necessary step in order to achieve economic and social or even enhance economic and social developments in that region. We heard earlier in the morning session from Dr. Al-Amiri from the UAE Ministry of Health about how the UAE in the recent past have used its economic might as well as population diversity in order to launch itself into the future in areas of science, including the COVID vaccine, for example, and in areas of space, going to Mars, sending mission to Mars, in areas of manufacturing and tourism. It has been historically established that peace and security are foundation for human developments. This is applicable to every region around the globe, no exception. So what the Abraham Accord undoubtedly had provided, even in the short term of the last 2 or 3 weeks, it provided hope for a region where hope has not lived up to its meaning. Beyond hope, I think the jury is still out. But hope is often associated with decreasing the level of tension. Decreased level of tension in the region may give rise to the space in time needed in order for ideas and thoughts about how to achieve sustainable peace, just peace in the region that will lead to sustainable economic development and healthcare development. So I hope that the Abraham Accord, certainly on personal level, I hope that it will not remain as a front page newspaper story, but rather it will translate into a sustainable platform for peace and security and economic development in the Middle East. I will hand over the podium to my colleague, Dr. Gassan Abou-Alfa, to give his closing remarks as well.
Thank you so much, Nizar. And I would like first to thank everybody for joining us this morning or this afternoon. And again, great thanks and congratulations to C3, chaired by Dr. Potter, for doing this amazing work of bringing us together again, despite that we are all in different parts because of the pandemic that we're all living. I second what Nizar said in regard to that, after all, this is all about humanity. And we're very proud to be able to connect all of us from wherever we are. And same time, we're very proud to see that healthcare, after all, is probably the best diplomacy. And after all, we're doing all of this only for one purpose, for our patients and for all humans, wherever they are. With this, I like very much the nice summary that Dr. Zein provided on all the sessions today. Be assured we have more to go, and there's quite a bit of activity that's waiting for us tomorrow. And it's going to be multivariate again from multiple institutions and multiple colleagues, wherever they are. And I very much look forward specifically for my dear colleague, Dr. Jensen Klaus, in the keynote panel discussion on the age of transformation and the ultimate, digital age that we're all living. Today, in his discussion, it was more of a kind of appetizer to a much more detailed, opportunity. We're going to hear more details about tomorrow. With this said, I will pass it on back to Ransel. I think we'd love to have one more featured video, and then we'll be closing it up. Thank you again, all of you, for being here. Thank you.
Well, I'd like to again thank everybody as well. It's been a challenge in these times. 2020 has certainly thrown everything at us, and I mean everybody and everything. And I think it's remarkable the way that we all continue to come together. I have found that over the last 10 years, healthcare diplomacy is really what unites us more than any kind of diplomacy, which I think is evidenced by the Abraham Accord. And believe me, I hope that we will all give peace a chance. And if we can play one small part, then we have been very fortunate in contributing. You'll see a video shortly by President Clinton, who actually helped us launch C3. And I remember asking him at the end of the very first summit, I said, President Clinton, if there was any advice that you would give an upstart summit like C3, what would that advice be? And he said 3 things, Ransel. He said, don't try and be a tsunami. That will surge and subside. He said, don't try and be a wave. That will crest and crash. He said, be a ripple, because a ripple keeps reaching out and interconnecting. And that's what I hope that C3 has been over the years, is a ripple that has been able to connect a lot of diverse personalities, a lot of diverse opinions. But by coming together and forming a dialogue, I think that we have in some way contributed to that ripple and that widening of everybody coming together. So thank you again. Hopefully you'll stay tuned for tomorrow. We have another great half day. And then of course, in the years ahead. So thank you very much from the bottom of my heart. Everybody, you have made me very proud and very honored to do the work that we've been doing. And again, thank you.
We do need more Americans doing business in the Middle East. We need more two-way trade and investment. We need more small and medium-sized enterprises involved. I think they're addressing all the issues, and I think that they recognize here that the larger benefit is greater understanding and looking at the positive side of the Middle East, the good things that are happening, all the people that are oriented toward the future already. And you can't spend all your time in life just to stop bad things from happening or reacting when they do. You got to spend some time trying to make good things happen. That's what this conference is about, and I think it's good.